Knowing your therapeutic approach, knowing the modality and the technique is really key to effective therapy. But there's something else that's greatly important and accounts for therapeutic effectiveness, and that is known as the Dodo bird effect. Welcome to the Art of Therapy, Season 3, Episode 25.
It's good to be back here in the studio just to continue on the art of therapy with you.
It is, yes.
And if we just have a look at our last episode, so the last episode we really explored and unpacked EMDR and just looked at how it was developed, what is the processes behind it, and how does it work. And we saw that it's really a very structured therapeutic approach that helps clinicians really to facilitate clients working through trauma, through desensitization, and then, of course, reprogramming as well.
Yes.
Yes. And then we also just added that there's also a different way to look at it. And we started to look at EMDR through a different lens, and that's the lens of hypnosis as well.
I think it's really interesting, as you note, that on the one hand, it's a very structured approach, which has an immediate appeal, and it's one can learn it, but then also not leaving it there. And we are exploring the art of therapy, and that means understanding something in more depth, the nuances, and then being able to look at it from a hypnosis lens. Yes, very interesting.
It really was very interesting to see it like that.
Yes.
Then maybe today we can just start to have a look more at the integrative lens, seeing that we looked at EMDR through a different lens as well, that we started to work with that integrative part.
Yeah, I think if we just reflect on when we started look at an existing therapeutic technique or application, but from an alternative approach, one is already there beginning to draw on an integrative approach, because we're looking at the same therapeutic phenomenon but using a different lens. And that shows us something. So working in this integrative way adds depth, it adds meaning, it becomes much clearer.
It is just looking at it from, it's something that's existing, but then, like you say, looking it through a different lens.
Yes.
It just creates even more understanding, more clarity to a modality and to psychotherapy.
Yes.
So maybe we can have a look at that, of what is the different, or what is the common factors in psychotherapy?
I'm glad you've noted common factors, because as we really unpack just some of the principles of an integrative approach, a founding premise here is really around this idea of, across various therapies and different orientation modalities, these common factors. And what that suggests is that when it comes to the therapeutic outcomes, these are very much determined by how something is approached therapeutically. It's the how of therapy, how it's delivered. Not so much the type of delivery or which modality, but the how.
Okay.
And as you and I explore this, really it again underscores the art of therapy, because much of therapy is in the how. And common factors really speak to this, that we can have many different orientations, and yet what is very often the case is most of these therapeutic orientations have these common elements across the modalities that really very often predict or account for the treatment outcome, which is amazing, given, as we've been exploring, there are so many different therapeutic modalities and the richness of them, and yet they have these common elements that account for a very big part of the therapeutic outcome and the meaningful effect.
There's some of these common factors that's present in all of the therapeutic modalities.
Yes.
And it's like one of them, the therapeutic relationship or the therapeutic reports that is established.
Yeah, that's one of the big ones. That the nature and quality of the therapeutic relationship. But maybe before we just look at them more closely, let's just back up a little bit and just see, just note where it's come from.
Okay.
So really the development is actually in the last century. Saul Rosenzweig was a clinical psychologist, American, and researcher, and really he proposed what today would be common factors, which was the Dodo bird verdict. And what he said is that there are these common elements in all therapeutic approaches that account for the therapeutic efficacy and the effectiveness, more so than the technique or the orientation itself. So, I mean, we're going back some time. This is actually going back to 1936.
Sure.
And that's really something. There have been lots of developments since then, but this was effectively a key contribution. And he called it the Dodo bird verdict because the dodo bird comes, of course, from Alice's journeys and adventures in Wonderland. And what really comes out there is the dodo bird who explains or says to everyone and excitedly, everybody's won. And so all must have prizes. And so he effectively coined this term, the dodo bird verdict, where, all therapeutic approaches have these common elements and account for very significant treatment gains.
It's like you say, it's the how of it. It's not the type, but it's the how. So everyone wins.
Everyone wins, indeed. Yeah. I think what's important is that this was the initial thinking, and then later there's more developments. One of the big things here was Saul wasn't saying that technique doesn't matter, that your therapeutic orientation doesn't matter. Really what he was getting across is the effectiveness and efficacy of any existing approach is that much stronger when carefully, meaningfully expressed. And that is really key. And it was then in 1961 the Franks began working further with this, and that was important. Jerome Franks and Julia Frank, they really strengthened this research, really looking at universal factors. Michael Lipton then in the 70s began to take this further and really began to look at a large part of the treatment gain is from these common factors, much more so than the actual techniques themselves. And then Edward Bordin did some really meaningful research. One of the great contributions there is focusing on the therapeutic alliance, the relationship. It's exactly what you've noted. So there's been this development and increasing awareness in terms of best practice, evidence-based. What is it around therapies that will increase the efficacy and the effectiveness? And these are the common factors.
It's actually amazing to hear that it's not just about the type of therapy, and we know there's so many different types, but it's one of the first steps is actually what is the common factors, and it's present in all of these different ones.
Yeah. On the one hand, it's seemingly obvious, but it's also not, because one can, in a technique or therapeutic approach, often just assume these factors. But no, looking carefully at it, once a therapist understands these common factors, it really helps to guide them and be able to express and work even more meaningfully therapeutically, because that's what every therapist wants to do, to help their clients as profoundly as they're able to, in a way that's sustained and meaningful. So yes, understanding these common factors is key, but again, not indicating that therapeutic orientation or technique doesn't matter. No, it just means that the delivery of that approach, the expression of it, when these common factors are considered and expressed meaningfully, is going to strengthen that therapeutic approach and the outcomes. So yes, of course, therapeutic alliance, that's key. And the principle there, and what's been established in research, is when the goals of the therapy are agreed upon, when the actual activities are agreed upon, and when there's an emotional bond with this in the therapeutic relationship in terms of the trust, the empathy, the respect. Wow, that is going to have an enormous impact on what can be achieved within the therapeutic relationship.
Thomas, it creates the groundwork for the therapeutic process.
It does, yeah. And having said that, therapeutic alliance is a key contributing factor across all therapeutic approaches and techniques. Of course, we would then expect, and we would know that the person-centered aspects are going to come up. So, interestingly, what comes up first is empathy.
Okay.
That really comes up very strongly. So being, as we've discussed so many times, understood accurately by another, when the therapist understands the client and does so in a way that's meaningful and accurate, that can profoundly contribute to the therapeutic outcome. I say what's interesting here is we've often discussed it in terms of authenticity and congruence first, but I'm going to come to that.
Okay.
So the empathy is so important. Then next one could consider that acceptance, that unconditional positive regard for someone, for all of us to be accepted without judgment and to be understood is profoundly therapeutic and it can be an enormous corrective. And then finally, the third element, the therapeutic, the authenticity and the congruence and of the therapist and what's occurring in the therapeutic relationship. Now, one would think that goes first, but what is interesting here is authenticity and congruence, and you and I have noted this, it's different from transparency. One can be transparent in a brutal but congruent way. That's not going to be of assistance. One needs to express in an authentic way that understanding and that acceptance. And that's key. So even if the authentic part is just expressed in that way, that is going to make a huge difference. Yeah.
And that's how come empathy is actually is before the congruence and the unconditional positive regard.
Yeah.
Because it's about the how to.
Yes. Yeah. So this is greatly valuable across any therapeutic approach. Then one, and we've noted this one, because they must come up, but hope and positive expectancy. We've said so often it's so important to communicate in a hopeful way and with positive expectancy, because we're all people, human beings, trying to manage, to cope, to find a way forward, no matter how difficult things are. And we all need that hope, insulation of hope. It needs to be realistic, of course, but again, one needs to look at this very carefully within the constraints. It's easy to judge a situation, but when one is in it, what are the avenues? What is a way forward? Is it another day? Is it another week? Is it a year? Is it another experience of a relationship? Is it cope? So hope and positive expectancy are so important.
Psychotherapy is not only a profession, it's a state of being. And for that, it requires continuous learning, training, and refining your skills. If you would like to become better in your role as a psychotherapist, come and join Dr. Warwick Phipps for in-person training at Treatment Works Centre, where you will experience training like never before from a thought leader and expert in psychotherapy. If you would like some more information on our training or to book a training session, please visit the link in the description. And also, if you find these podcast episodes meaningful, please subscribe to The Art of Therapy. Those are a couple of the common factors. So it's the nature and quality of the therapeutic relationship,
Yes.
but then also empathy and unconditional positive regards and authenticity of the therapist.
Yes.
But then also the installation of hope and speaking positively as well.
Yes.
And those couple of them it is a common factors in therapy.
Yes. If a client really knows that there's some way forward and it's realistic, it's hopeful, and they've already got an expectation of this being a positive, meaningful, productive process. Wow. A big part of that therapeutic process is already underway. That's how important it is.
And then it is, if any type of modality then is utilized or any technique is utilized, it actually it creates so much room for that to work.
It does. Yeah, it powerfully strengthens it and creates possibility. Yeah, as we are looking at some of the factors, something else that has emerged and important to consider is it's important for the client to have some credible, meaningful explanation or understanding of the therapeutic process or what is being utilized. That's like the big why. As human beings, the why matters. And if that's coherent and it makes sense and it fits for a client is reasonable, and would like to then move in that direction. So yes, something that's coherent and makes sense for the client. It's not something being done to them. It's something that they're part of, that they understand, and that's really important.
And that gives empowerment as well.
It does, yes. Something else to consider is that where there is a corrective emotional experience, that's so important. Anytime a client has an experience that's a corrective emotional experience, such that they were expecting possible rejection, but they experience acceptance, or being misunderstood, but they are understood, or there has been some painful rupture in the therapeutic bond for whatever reason, but that's reestablished. While these go towards corrective emotional experience. If someone can work through a difficulty or conflict in a therapeutic relationship, being guided but work through nevertheless and have that corrective, imagine what they can do, in their primary system and in other relationships, the hope that brings, the confidence. So corrective emotional experience. Also, I hesitate to say this, but we must go there, emotional processing. Of course, a big part of what is in common between therapies and approaches is emotional processing. Now, I say I hesitate, because every time I see this in the movie, I just sort of cringe when the actor, the therapist actor says, "How does that make you feel?" So, but while that's a stereotype, the principle here is when someone can do emotional processing, begin to give accurate expression to their emotion, can begin to integrate emotion. Because that's, as we've discussed before, is difficult. Sometimes we don't know how we're feeling. We don't know how to identify or even name what we're experiencing. But as we communicate and share and we're relating, that it can be part of our experience. So yes, that emotional processing, very important.
And it's there through all the modalities.
Yes.
And that it's important during the process of therapy, no matter what modality is being used.
Yes, very much. Yeah. Then, of course, there are going to be client factors, aspects relating to client motivation, the client's circumstances, their own strengths. These are going to be important and are in any therapeutic approach. And then, of course, the therapeutic or the therapist effects. As therapists, to the extent that a therapist is really responsive, flexible, perceptive, skilled, is able to engage in a way that's meaningful, of course, that's going to strengthen greatly the therapeutic process. So, yeah, therapy or therapist effects are very important.
Yeah, there's so many to consider, and it's helpful to actually know these, because then the therapist can focus on these ones.
Exactly, yeah. Because sometimes, again, therapy can be so overwhelming. One wants so much as a therapist to help and to bring relief to the suffering of others. But sometimes it can be a bit overwhelming. And if one just has some of these pointers, it just consolidates, and it also gives one more confidence. So we could actually look at it that, if we sort of summarize that, all of that, and what are the big things to look out for? Of course, client effects are going to be important. The client's motivation, their own skills, their strengths, their unique circumstances. Then, of course, the therapeutic relationship, the alliance, and the degree of empathy, positive regard, unconditional positive regard, and being authentic. Then some credible explanation, the why. That's going to be really important. And then some meaningful application or utilization of the therapeutic approach, some meaningful approach. Wow, that is done, and it's really approached with a lot of thought and intentionality. That is going to potentially bring about some profound change.
And it is, like you say, a therapist, there's so many things to focus on, there's so many choices to make. But if that becomes the groundwork, it's already the groundwork, and you can work from that.
Yes.
And then it sets up the therapy to be much more effective for the client then.
Very much, yeah.
And that's then really starting to understand therapy and understand how different modalities have common factors in all of them.
Yes, that's why we've noted before, therapy is not just a doing or a following. It's a process. The more one understands therapy, understands the why and the nature of it, the more meaningfully and the more that can be expressed, more fulfilling. And to know, yes, across all modalities, therapeutic approaches and techniques, there are certain elements that are common, that are distilled, that when those are considered and expressed, utilized, are going to be associated and will result in increased support, increased efficacy of the treatment. That's really something. And that's what psychotherapy is really all about.
Yes. No. And I think just having had a look at the common factors, it also makes me think then, what is other aspects of the integrative approach? And maybe we can have a look at that as well, maybe in the next episode as well.
Yeah, let's do that. We can begin to just explore some other principles, ideas, and go from there. So I like that.
Okay, looking forward to that.
Yes.
Thank you for joining us on The Art of Therapy. If you found this episode meaningful, or if it expanded your knowledge, we would love to hear from you in the comments section. We are looking forward to continuing this journey with you. Until our next episode.